Hello and welcome to Eskimo TV. I'm talking today to Dr. Bob Chatterjee. Dr. Chatterjee is a consultant spinal surgeon and director of the North London Spine Unit. Hi Dr. Chatterjee, how are you?
Hello, I'm very well, thank you.
Dr. Chatterjee, today we're talking about degenerative disc disease. So what is this condition?
Well, if you forgive me, I use an analogy of a jam donut to explain this to my patients. So imagine a donut with a lovely soft jam filling inside, and this rather mimics what a disc is like. The disc tries to act as a shock absorber, and the jam in the middle is nice and soft and jelly-like and helps to provide the sort of bounce within the disc. And the dough outside the jam is the sort of encasement material which keeps everything in the right place. The trouble with degenerative discs is that as we age, there are certain changes that happen within a disc. So first of all, you start to lose the amount of jam inside your disc. So rather than being nice and bouncy, it tends to become a bit flatter and doesn't have the elastic properties that it used to have. Secondly, the dough also starts to get a bit thinner, and sometimes you can also start to get some tears into in the dough itself. And if that becomes particularly prominent, then sometimes the jam can even escape out. But it's these changes of a loss in elasticity and a loss of the hydration of the disc are the characteristic features of a degenerative disc.
So who's at risk for this disease?
It tends to be something that happens much more common in the aged population. So our risk tends to increase as we get older. There is some genetic predisposition again involved in development of degenerative disc disease. We've certainly noticed that it runs in some families. And certainly we think that environmental factors such as your occupation, your hobbies and sports can also influence the rate at which degenerative disc disease might progress.
So how is degenerative disc disease diagnosed?
So typically we see the patient and take a full history and an examination. And usually from the story of the patient, mostly the diagnosis becomes fairly clear. The definitive diagnosis is always done by MRI scan. It usually reveals excellent information regarding the disc itself and any structures that it might be pressing on. But typically on an MRI scan, what you will see is that the disc has lost its height. It's lost a lot of the inner material of the disc that normally shows up quite brightly on an MRI scan. On a T2 image will look quite dark.
So once the person's been diagnosed, what is the treatment options available?
As with most things in spinal surgery, we always start off with the non-operative measures. So simple measures such as physical therapy, maintaining good posture both at home and at work, and good nutrition and diet are all very, very important. And these will certainly help to ameliorate the symptoms. The next stage up from that is we can often do injections into the back. Again, usually we use these injections as temporary pain relievers so one can enter into the physical rehabilitation program, because often if you're in a lot of pain, you simply won't be able to do the exercises that are required of you. And finally, we can consider surgery. Surgery is quite controversial for degenerative disc disease. There is no clear evidence that surgical treatment, which is usually consistent with fusion, necessarily will generate good results. So it really becomes a question of meeting a patient and deciding whether you think that their symptoms will improve, but it's not a perfect science.
So can degenerative disc disease be prevented?
It can't be entirely prevented, as we will all age. However, there are things you can do to slow the onset of the disease and also to delay its progression. So particularly keeping in good weight. The more weight you carry, unfortunately, the more pressure you will apply to the discs, and that will cause them much more likely to degenerate. Smoking is a big issue. The nicotine in smoke, unfortunately, affects the biochemical constituents of the disc and makes them more likely to weaken and rupture. Physical therapy is excellent as well, because what it tends to do is it makes the muscles which surround the spinal column very strong. And if you can do that, then you can offset some of the weight that goes through the spinal column and put it onto the muscles instead. and thereby you offload the disc, again, preserving its life better. So there are a number of things you can do to help.
Thank you, Dr. Chatterjee. Thank you so much for talking to me today.
My pleasure. Thank you.